Hey there. Are you searching for an alternative career? Maybe you've been seeing more health or life coaches and wondering, what does it mean to be a health coach? And is it really a career that you can pursue? Well, in this video, I want to help clarify what being a health coach means and what the career potential is and how to become one. I know when I first discovered health and life coaching that in general, at the time, it was still a relatively new sector and even sounded too good to be true. The health and life coaching space has exploded, and you may even find it hard these days to not run into one online or maybe at a networking event. I could not believe that I could make a living doing what they said they were doing. So what is health coaching? There are a lot of names for it. It can be wellness coach, life coach, health coach. Some people even create this slew of labeling like transformational coach because they're describing what they're doing as opposed to the sector. They may even call themselves holistic healers, which is one of the names I truly love because I feel like it kind of encompasses a lot of the modalities that we're using to heal. The overall focus of coaching and healing is a more collaborative approach though, in comparison to a traditional healthcare model. For me, coming from a pretty strict medical model since I graduated from med school, in which we are taught not to share about ourselves or to just tell the client what is wrong with them and what they need to do, because it is more focused on the diagnosis and symptom and a treatment through pharmaceutical care. Coaching is quite different. It is much more of an empowerment partnership. When I first started learning about it, I was like, holy cow, like it actually creates a bit more faster change. We as coaches provide more support and guidance to help that client reach their personal goals, whatever it may be, and create a meaningful change by collaborating with them, by kind of going back and forth, as opposed to in a typical model of medicine, it's more of the doctor telling them what they need to do, as opposed to hearing as to what some of the barriers are as to why they're not doing that. And there are a variety of tools and holistic approaches that coaches may use in order to create that change, and they hone in on specific areas, being some of the most common ones that they like to focus on, such as nutrition, exercise, mindfulness, and positive reframing. But coaching is less, again, a symptomatic approach and more of a holistic approach. Now, are there any licensing requirements to being a life or health coach? No, there isn't actually. There's maybe some misconceptions that you need to go to a specific school or have specific credentialing, but there are no federal or state licensure requirements to becoming a health coach, wellness coach, life coach, really whatever coaching or consultant you want to consider yourself. And because of this, really anyone can become a coach. However, that doesn't mean that anyone should become a coach or a health coach. Many health professionals such as nurses, PAs, therapists, or doctors do go into health coaching, and it's a slightly easier transition for them. However, it's not because they're licensed or anything like that. Maybe it's because they have some foundational background that allows them to build their confidence more in order to help people in that area of wellness. But there are a lot of different techniques in coaching that helps create lasting change that one would want to learn by finding maybe a reputable school. And it doesn't necessarily need to mean that that school is going to give you a license. But there are good coaching programs that will give you at least the foundation of how to utilize some of the techniques that create positive and fast change for your clients, which is one of the most important things about being a coach. It's creating that change and getting them the results that they're looking for. Now, because becoming a health coach does have a low entry level, meaning that anyone can become a health coach, getting a job working as one can be a little bit more difficult. Being able to succeed in becoming a health or life coach really depends on the individual in order to create a viable independent business. Although there are plenty of people out there that do work for other businesses, usually it's another health coach that created that and needs some help. When one does this and becomes their own employee, essentially, they are able to scale and make a wide range of income. And that's why there's such a wide range that you may see online. So I would say don't get discouraged if you see that, especially if you're already in the healthcare field and you're looking at your current pay and you're like, why would I make that transition? The ability to scale and grow and how much you make really is dependent upon you. So if you're considering becoming a health coach and leaving a corporate job, it would be essential for you to learn about opening and running a business. A lot of coaching schools do neglect this part of the education, which is one of the barriers I feel many health coaches being successful is their lack of understanding how business works. It's not because we don't need health coaches and that there's not enough space for them. Quite the contrary. It's that nobody knows about the services available and this alternative field that is exploding, but still not the first direction of care unless a doctor, a therapist, or someone within the field is referring to you. Or maybe they're searching online and just find some information about you. But then at that point, then they start searching within the health coaching field, and then it's hard to find who really sticks out and really aligns with what they're needing. And that comes with the proper marketing and the words that you use. Health coaching statistically is growing rapidly, and the demand is there, I can guarantee you. Many people are wanting answers on getting rid of bad habits or hitting a dead end within the traditional medical model, or simply they're just waking up. And I do think that the post-pandemic era is really, that's the silver lining in that experience, to be able to expose that there are a lot of people that just really don't feel well, and the traditional medical model is not really supporting them the way that they need to be. And it's not at the fault of any healthcare professionals, but it's just the healthcare system that has exploded in a way to focus on profits and insurance companies and medical care as opposed to the quality of care of the clients and the long-term sustainable means of helping them outside of pharmaceutical treatments, if that makes sense. So health coaching is statistically growing rapidly, so the demand is inevitably there. Many people are wanting answers and help with their bad habits or health choices, or just simply needing to understand what they need to do because they're hitting dead ends within the healthcare system. So they're not really aware of many of the holistic or alternative approaches that could really significantly help them, either that be through food, being our true medicine, and the power of our mind, which really can create transformation through the power of belief. We have society-wise created so many conditions to believe that the medical model or that one way of doing things is the only way, when coaching for me definitely created this space of a collaborative approach that just felt more empowering, and I personally seen a lot of great change for my clients. So just to give you some insight, health coaches are greatly needed more than ever. It is valued that health coaching industry in 2021 was worth $15 billion, and it's expected to hit $25 billion by 2030. Now is better than ever to jump in because of this evidence that is showing the growth within this area. And so the outlook of health coaching is phenomenal. I believe it's going to be the main alternative and also the main direction that we're going to go to replace the healthcare model. That's why I do believe the outcome of becoming a health coach is great. So in conclusion, really becoming a health coach is a collaborative effort, and there's a lot of different directions one can go in becoming a health coach. It is a real career. It truly is. It's amazing to think in this day and age how many other alternative careers are, but we become very conditioned to think that the only way we can do things is how we were shown in school. And we're starting to wake up and change, see that there are alternative ways that are even better in order to support patients, clients, or those that are just needing help. And so I hope this helps, and I would love to hear your comments below. And if you also want to pop at some schools, I didn't mention that in here because I do know a number of schools for becoming a coach or teaching you coaching modalities, but there's just so many. And for me, I personally went through hypnotherapy school that taught me how to create change. I mean, I had confidence within myself to be able to coach people. And so for me, I went that route as opposed to going to a coaching school or life coaching school, which does teach you some of the similar modalities. It's all about creating change. And of course, one would not want to be in a sector or an area of specialization within the healthcare model if they did not have appropriate training within that. So if you're going to work with clients for diabetes, but you don't know about insulin or medications or things that they may be on, then you can't give them any advice on that. Obviously, same thing would go for any other area, like maybe hypothyroidism, or maybe for people with serious trauma. If you're not well trained and didn't do an extensive training program to prepare you for that area, then I would make sure that you include that in your legal documents, and also do not offer those areas of care. And I hope this helps. Until next time, have a great one. Bye.